Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teacher Module, Provider Burnout. The objectives for this module is that by the end, learners will be able to define burnout and describe the signs and symptoms associated with it, describe the epidemiology of burnout within health professions, and discuss the implications of provider burnout on both the provider and their patients. So let's start by defining burnout. Burnout is a job-related stress syndrome resulting in emotional exhaustion, depersonalization, and reduced personal accomplishment. Now, the critical part of that definition is that it is job-related and stress-driven, and that it results in those three main things. First, emotional exhaustion, which is commonly seen through loss of enthusiasm for work, feeling helpless, trapped, and defeated. Depersonalization, which is commonly seen through treating patients indifferently, objectifying them, and developing negative attitudes towards their colleagues and the profession. And lastly, reduced achievement, which can be seen commonly through withdrawal from their responsibilities and detachment from the job. Now, within the health professions, the various health professions, burnout has been seen at disproportionate rates compared to the general population. It's estimated that over 50% of healthcare providers experience symptoms related to burnout. 1 in 3 physicians have experienced burnout at certain points through their careers. Now, those stats differed based on 1 out of 3 physicians having experienced full burnout, while 50% of healthcare providers have experienced symptoms related to burnout, but both are very important to acknowledge. Now, it's important to recognize that burnout is not just important to look for within full-fledged physicians and other licensed health professions. It's also important to look for burnout within students, residents, fellows, interns as well, as we see 31 to 49.6% of medical students have experienced burnout, and 76% of internal medicine residents experience burnout. These rates are high and they're alarming, as we'll see later, that burnout has major complications, not just for the providers, but for their patients as well. Now, one study has identified some high-risk populations for burnout, specifically specialties of trauma surgeons, urologists, otolaryngologists, vascular and general surgeons. Younger health professionals that have children and who are also working 60 hours plus a week, having to take more than 2 call shifts per week, and having compensation that's entirely based on billing. Now, those are kind of high-risk populations, but some general risk factors for burnout that are important to know about are failure to achieve work-life integration. So if someone's work and their outside of work life are not matching well, they're not melding well, that's a risk factor, as well as lack of individual and organizational value alignment. So if someone's values do not align with the mission of their organization or the actions of their organization, that can be stress-producing. Increased work hours, as well as bureaucratic and administrative work, are risk factors for burnout. Increased screen time on the electronic health record, which is extremely common these days, is a risk factor for burnout. An increased focus on productivity within the organization can cause stress for employees, as well as lack of leadership support, lack of meaningful work, lack of relationships with your colleagues at work, as well as lack of flexibility and work control within the work environment are all risk factors for burnout. Those are some general ones, but there could be more depending on the individual and depending on the workplace. But it's important to know how to identify provider burnout. So there are some signs and symptoms that you can look out for, as well as some more standardized screening methods to identify burnout. But first, for the signs and symptoms of burnout, they include mental and physical fatigue, loss of altruism, gain of cynicism, lack of competence and self-efficacy, poor quality of work, increased medical errors, patient safety issues, poor patient satisfaction, lack of provider engagement, poor patient retention rate, and early retirement. These are all usually a result of the emotional exhaustion, the depersonalization, the low productivity and accomplishment that we see through that burnout definition. And the standardized screening, the gold standard for burnout screening is the Maslach Burnout Inventory, also called the MBI, which has 3 domains with questions to cover those 3 parts of burnout: the emotional exhaustion, the depersonalization, and the personal accomplishment. And increased scores for exhaustion and depersonalization and lower scores for personal accomplishment are associated with burnout. And within the learning materials for this module, I've included the MBI so you can see it, so you can go through the questions and see how they rank the scores numerically in terms of risk for burnout. Finally, I'd like to talk about the implications for burnout on not just the provider, but also their patients. So we know that burnout is stress-driven. Stress from your job that can cause burnout. And burnout can then progress into depression. Depression can then progress into suicide. And now that's not always the case for everyone. Suicide as a result of burnout is more highly associated with individuals who have underlying underlying mental health issues or depression that can lead to higher rates of suicide after burnout. But we also see some other things to consider within this pathway. So stress can also lead to drug and alcohol addiction, isolation, and repression. So can burnout. So burnout can lead providers to use drug or alcohol addiction to cope, isolation and repression, and then those behaviors of providers with burnout can then increase their risk for depression as a result of their burnout. Lastly, it's important to recognize how burnout affects the provider's patients. And we saw this through the signs and symptoms of burnouts that I listed earlier, that burnout can lead to poor quality of work, medical errors, safety issues, and poor patient satisfaction, all of these putting the patient's health and well-being at risk. So burnout not only extremely jeopardizes our providers' mental and physical health, but also the health of their patients, which is why it is so important that us as individual providers and that institutions within medical education and medical practice are aware of burnout and implement interventions to prevent and address burnout, which is what we'll discuss in the following presentation. Thank you.